So let's talk about pain because that is a huge issue. And you mentioned migraine headaches and joint pain. And I know that you've worked miracles with people with back pain and most everything. It's all natural remedies with PRP, right? So you're working magic with pain for anyone in Denville, the Denville, New Jersey area. That's your
Mhm.
man right there. If you think there's nothing that can help you, go over and see Dr. Fawad Mian because he can help you. Tell me a little bit about PRP and what you're doing with PRP, and it's all natural, right?
Yeah, I mean, PRP is essentially what you get from your own body. So there's nothing, aside from me, anesthetizing things and a little bit of saline, you're pretty much using your own stuff. And so platelet plasma can pretty robust. And originally it was used in the dental world and for wound healing back in the 90s. And then over time, we found it to be more successful for more musculoskeletal issues. For instance, the first iteration of where I used it actually was at least probably 10, 12 years ago. And, I had an individual with some tricep pain and, the patient had gone to orthopedic doctor and then the pain doctors, nothing was getting better. She had a little bit of tear in her triceps tendon. So I actually treated that with PRP at the
Hmm.
time. And even though it took, a few rounds to get it better, she was way better than where she was. She wasn't suffering just trying to do things because she was more of like a manual labor person. So she was just trying to use her arms all the time. And that was her livelihood. It's certainly working. And so if I had dumped steroids into that tendon, that would have been irresponsible because if you dump steroids into a tendon, you're just breaking it down even faster, which leads to more of a surgery that would have been completely unnecessary. I've had lots of PRP and polytherapy and all that over the years, and that's something for me where I was able to overcome plantar fasciitis, which is issues with your foot as well as an Achilles that was kind of beat up too as well, and that prevented me from having surgery. And at one point the surgeon was like, "Well, I think we just need to shave the bone down because nothing, you're not responding to anything." I've had all sorts of surgeries and I've had steroids. I've had a lot of stuff patients always ask about, so I've kind of gone through a lot of what they've gone through. And having gone through all of that, having said that, I wouldn't even hesitate now to err more on the side of doing platelet-rich plasma or even stem cell therapy or prolotherapy, just because I think at the end of the day, it's going to preserve things much longer for you. And sometimes when you do surgery, you can't really go back because then the anatomy has been altered, and then sometimes that can lead to its own series of problems. And in which case for me, I had a knee problem where I tore my ACL and the graft didn't take essentially. And so I had to go in there with PRP and put PRP in those areas to help alleviate that. That really helped me. And I've had plenty of patients where we had to do that too as well. Just because you have surgery doesn't mean everything is going to be great. It doesn't mean that you won't have issues or whatnot. And you definitely want to carefully consider whether or not you need to have surgery. In some cases, you very well may need to have it for very clear-cut cases, but that's not always going to be the only solution each and every time. And even just taking pain relievers, over the counter or whatnot, they don't necessarily help heal things rather than just simply giving you a temporary pain relief. For me, I definitely give people their options with things and try to get to the root cause as much as possible and try to get people on their way where they feel like they can function and do stuff with their families and play with their kids or do the activities that they love to do.